Hello viewers, welcome to my YouTube channel. Today in this video we will talk about why taking excessive painkillers can kill you. However, before we start our countdown, we would appreciate it if you would subscribe to our YouTube channel and also press the bell icon. So, let's get started. Number 1. Liver damage. When you pop a painkiller, it goes on a journey through your body. Most painkillers, like acetaminophen, found in Tylenol, are metabolized in the liver. Now, your liver is like the superhero of detoxification. It processes stuff to make it harmless. But here's the catch. Taking too many painkillers is like bombarding your liver with more work than it's signed up for. The liver has to process all those drugs, and when it's overwhelmed, trouble brews. One key player here is a toxic byproduct called an APQIN, acetylp-benzoquinoniamine. In small doses, the liver can handle it like a champ, but with more painkillers, NAPQI production goes into overdrive. It's like a mini explosion happening inside your liver cells. These explosions damage the liver cells and trigger inflammation. Over time, this constant damage and inflammation can lead to serious liver issues, like cirrhosis or even liver failure. So always stick to the recommended dosage, and if you are in pain frequently, it's wise to consult a healthcare professional. They can guide you on pain management without putting your liver through a roller coaster ride. Number 2. Gastric ulcers and bleeding. Your stomach has this lining that protects it from its powerful digestive juices. It's like a superhero shield against stomach acid. When you take too many painkillers, they mess with this shield. They do this by messing with something called prostaglandins. Prostaglandins are like the architects and builders of the shield. They help in making it strong and also in repairing it if there's any damage. But when you pop painkillers, they tell these builders, "Take a break, we got this." And guess what? The shield gets weak. Now, without the usual maintenance screw, the stomach acid, which is normally chill, starts attacking the lining. Over time, this constant irritation can lead to nasty things called ulcers. Ulcers are like painful craters in your stomach lining that can bleed. Number 3. Cardiovascular risks. So your heart is this hard-working muscle, right? It pumps blood, keeping the whole show running smoothly. Now, when you indulge in painkillers more than your body would prefer, it messes with the blood vessels and can affect how your heart does its job. One of the major culprits here is a group of painkillers known as non-steroidal anti-inflammatory drugs, nsaids. Nsaids can disrupt the balance of certain chemicals in the body, leading to increased blood pressure. Your blood vessels narrow down, creating extra stress for your heart to push blood through. Now, it's not just me saying this. In the study published in the journal Nature Reviews Cardiology, researchers found that prolonged use of nsaids was linked to an increased risk of heart attacks and other cardiovascular issues. So, maybe give your heart a break before you go all in on those painkillers. Number 4. Kidney problems. Your kidneys are these amazing filters that sift through your blood, removing waste and extra fluids. Now, painkillers mess with the delicate balance of hormones that regulate blood flow to the kidneys. This disruption can lead to reduced blood flow to the kidneys, causing them to work overtime to maintain their filtration duties. Also, painkillers can make you pee more, and if you're not chugging enough water, your kidneys are left high and dry. Now, let's talk about a study that puts the spotlight on this kidney drama. A research paper published in the Pharmaceuticals Journal found a link between prolonged NSAID use and an increased risk of kidney problems. This study followed a bunch of folks over several years, and those who popped NSAIDs like candy had a higher likelihood of developing chronic kidney disease. Number 5. Hormonal imbalance. Our bodies have a bunch of hormones that control all sorts of stuff, like how much stress we feel, how sleepy we get, and even our mood swings. Painkillers, when taken too much, can throw these hormones out of whack. One way they do this is by messing with the endocrine system. Think of the endocrine system as a hormone headquarters. Painkillers can disrupt the messages sent by hormones, confusing the hormone traffic. For instance, they mess with hormones like testosterone and estrogen, which are like the supervisors of growth, mood, and energy. We've made it halfway through our list, and we sincerely hope you've enjoyed it so far. Please don't forget to subscribe to my channel. hit the like button, and ring the notification bell if you want to see more content like this. Let's move forward with the video. Number 6. Increased sensitivity to pain. When you take a lot of painkillers, your body might think, hey, we've got these superheroes doing all the work. Time to chill and not make our pain fighters. It's like your body becomes a bit lazy in producing its natural pain-fighting team. Now there's this cool study by researchers where they found that too many painkillers can mess with your body's ability to deal with pain naturally. It's like telling your body, relax, the superheroes got this, and your body forgets how to fight pain on its own. So when you stop taking the painkillers, or they wear off, your body is left high and dry. It's not prepared to deal with the pain because it gets lazy, expecting the superheroes to do all the work. And that's when you might feel even more pain. Number 7. Weaker immune system. Inside your body, there are these cool cells called white blood cells. They're like the frontline soldiers of your immune system, ready to tackle any intruders. Now, painkillers can throw a curveball at these white blood cells. They mess with the signals these cells use to communicate. Imagine your immune system trying to fight off an enemy, but the messages are getting mixed up. It's like telling your superheroes, it's not that big of a deal, take it easy. Now, when your immune system is not in its A game, those nasty invaders have a better chance to sneak past the defenses. And before you know it, you might find yourself getting sick more often. Number 8. Nervous system effects. Painkillers mimic the natural chemicals in your brain that control pain and pleasure. So when you pop those pills, your nervous system gets bombarded with these fake signals, making it go a bit haywire. Now let's talk about a term you might have heard, tolerance. It's about your body getting used to the painkillers. Your nervous system becomes less responsive to them over time. So what happens next? You might find yourself reaching for higher doses just to get the same relief. And when you decide it's time to part ways with your painkiller pals, your nervous system throws a tantrum. A study in the journal Drug and Alcohol Review reveals that painkiller withdrawal can trigger an increase in stress hormones, leading to anxiety and a wild emotional ride. It's like your body saying, hey, where are my superhero signals? Number 9. Respiratory failure. The respiratory system ensures you get the oxygen you need without even thinking about it. However, excessive use of certain painkillers can throw a wrench into this smooth operation. Some painkillers, especially opioids like oxycodone and morphine, have a special relationship with your brain. In severe cases, excessive opioid use can even lead to a dangerous condition called respiratory depression. It is when your breathing becomes dangerously shallow or slow. Imagine your body needing more oxygen, but the opioid party in your brain is like, nah, we're taking it slow today. This slowdown in breathing can lead to a lack of oxygen in your body, which, as you can guess, is pretty bad news. In extreme situations, it might even result in a life-threatening scenario. Number 10. Constipation. Your gut has this rhythmic muscle movement called peristalsis that keeps things moving smoothly. Painkillers decide to be the party crashers here. They mess with the nerves in your intestines, slowing down peristalsis. As a result, your stool decides to take a stroll through your intestines, soaking up more water than it should along the way. The outcome? Constipation. That uncomfortable feeling when your bathroom visits turn into a bit of a challenge. And if you're on prescribed painkillers, here's a tip. Drink more water. So, next time you think about reaching for that quick fix in the form of a painkiller, pause for a moment. So, this was our today's video. I hope you all liked this video. Don't forget to hit the like button and subscribe my channel. And also share it with your friends and family. We will be back soon with a new video. Till then, keep supporting and take care.